Hi, I'm attorney Gregory Dell, and I'm joined by attorney Rachel Alters, and we're going to discuss Lyme disease and long-term disability insurance claims. Rachel, Lyme disease has been a medical condition which you have a tremendous amount of experience with, and you've kind of become our in-house Lyme disease disability expert. So I'm glad that we're able to discuss this with you today. But Lyme disease is not only a challenging diagnosis and finding treatment protocols for it, but it's also very difficult when it comes to securing long-term disability claims specifically for Lyme disease. And a lot of people call and say, look, I've been diagnosed with Lyme disease. Do you think that that in itself will get me approved for disability? So I want to talk about in this video what it's going to take to get approved for Lyme disease, talk about some of your experiences in handling these claims and things that claimants will need to have in their medical records in order to give them the best chance to get approved. So right off the bat, why is it, Rachel, that Lyme disease is challenging when it comes to long-term disability claim approval?
Greg, I find Lyme disease is the most challenging diagnosis and illness that my clients have because the insurance companies have a field day when they see a claim come in with a claimant who's diagnosed with Lyme disease and that's their only diagnosis. They oftentimes will immediately deny those claims because they can find reasons why they don't believe the diagnosis is valid, or that yes, there's been the diagnosis, but in their expert opinions that the restrictions, limitations, symptoms of the Lyme disease aren't disabling enough to approve the claim. And it's extremely frustrating for my clients because Lyme disease is a extremely debilitating disease. And unfortunately, when it happens, sometimes the Lyme disease isn't caught for many years after the person becomes infected. And the way in which people get infected with Lyme disease is through a tick bite. And sometimes, but very rarely, when bitten by a tick, you will get a bullseye rash, which is, a rash that's a ring, whether that's on your arm or your neck, wherever it may be, that will indicate that you were bitten by a tick. And then if you're lucky enough to have this rash, then the doctors can say, okay, this is evidence that you were bitten by a tick, and this explains why you're having these symptoms. But I would say probably 80% of the people who are eventually diagnosed with Lyme disease never knew they were bit by a tick. They live in areas such as in Connecticut or upstate New York where it's prevalent to have a tick, have ticks carrying Lyme disease. But they never saw, ticks are very small, and oftentimes people are bit under their hairline or in places where they can't see the rash, or they never even developed a rash. So they walked around with years with these symptoms and they didn't know what they were from. So the insurance carrier will will have a field day when there's no evidence in a medical record of any kind of rash, yet somehow somebody was diagnosed with Lyme disease through blood testing and other tests that they can perform. They will say, well, we don't see evidence of a bullseye rash. We don't see evidence of the fact that they were even ever bit by a tick, so therefore we're denying that they even have Lyme disease. So unfortunately, it is a frustrating process for a patient and a claimant to go through trying to get disability benefits paid when they have Lyme disease. And there's a lot of different ways that the insurance carrier will say, oh, well, we don't think that they actually have this disease, even though their doctors who they've been treating with for years are positive that they do have Lyme, that their symptoms are related to Lyme disease, and that their blood results, their CBC that came back and shows that they're IgG positive and IgM positive. The insurance carriers will still deny that because there are two different schools of thought with Lyme. The CDC looks at Lyme disease one way and says that if you have had Lyme disease and you're diagnosed with it, but you've received IV antibiotics, you're cured, which is 90% of the time not the case. Then there's the school of thought that's followed by ILADS, which says you can have chronic Lyme and it can stay within your body for years, even if you do receive antibiotics many times. And a lot of people are suffering from Lyme disease for years and years and years, and it affects them not only physically but cognitively. So it's a very frustrating process. We know what to look for when we're filing a claim for Lyme disease, and we know the kind of testing that doctors need to do. It doesn't mean that the insurance carriers are going to accept the test results or the doctor's opinions. It's usually a battle, but we know how to win that battle.
Do the disability carriers, in your opinion, consider there to be objective evidence of Lyme disease? Is there any type of testing that is accepted by them as objective evidence of the diagnosis?
Yes, I mean there's they do testing where they test the IgG and IgM levels, but unfortunately, if you don't have a certain number of bands, so when you have the IgG and IgM positive bands, if you don't have a certain number of bands, the CDC will look at that as being Lyme negative. But a lot of doctors who are following other standards say, oh no, if you have at least 5 bands positive and you have other symptoms like your Babesia is positive or you have positive Bartonella, there are many co-infections that come along with Lyme disease, that it's not just Lyme, but there's co-infections that make the Lyme disease symptoms worse. So those are all objective tests that can be provided to the carriers as objective proof of Lyme disease. Unfortunately, they have peer review experts, infectious disease doctors on their team who oftentimes, most times, will reject those as well. Yes, they were Bartonella positive, they were Babesia positive, but they didn't have enough IgM or IgG bands, or the IgM bands showed up late, so that means that they don't have Lyme anymore, those are old antibodies that are in their body from a long time ago, and their Lyme disease is now gone. There's also cognitive testing that can be done many times, and I can't tell you how many times my clients come to me and say, I have pain throughout my body, I'm fatigued, I have all these physical issues, but cognitively I can't focus. I have clients who have seizures, I have clients who have visual problems. So all of that can be tested and shown through a neuropsych evaluation. We know special doctors who specialize in Lyme issues and that cause neuropsychological issues as well. So we oftentimes can recommend that testing be done by these doctors who are well versed in Lyme disease, who can give a neuropsych evaluation to a client and say, okay, this makes sense why they are having issues with memory, executive functioning, and all those things because of the Lyme disease. And that's what the Lyme unfortunately attacks the brain in that way and can create lifetime long-term effects in patients who have been stricken with Lyme disease. So there's many tests that can be done. Unfortunately, the insurance carriers will not always accept these test results as meaning that the claimant is disabled, but we do have to work with their doctors, specifically one-on-one to get them to write things a certain way in the records and fill out attending physician statements in such ways that will show that, yes, this claimant does have Lyme, the Lyme is severe, the Lyme disease is causing restrictions and limitations that are preventing them from being able to perform the duties of their job.
And I think, Rachel, what's unique about the approach that you and I take and the strategy that we've put in amongst our lawyers in the office when handling these Lyme disease cases is we're not really going to get caught up in the objective evidence due to the controversy in the medical community about what's accepted or what's not accepted. At the end of the day, the disability insurance companies always try to throw in our face that diagnosis doesn't equal disability. So there's many people who spend, and a lot of our clients who spend years and years of their life trying to chase a diagnosis, but it doesn't mean that they don't have the symptoms that they complain of. So no matter what the diagnosis is, whether it's Lyme disease, whether it's an arthritic condition, whether it's cancer, whether it's anything that we've represented anybody with, but especially with Lyme disease, the more important thing is to focus on the symptoms, because it's the symptoms that are disabling. It's the symptoms that prevent the person from being able to work. And there isn't a causation requirement in the disability insurance policies where you have to prove that you have that specific disability condition. You just have to prove that you have a sickness. And obviously you're sick if you're having these types of symptoms and repeatedly seeing a doctor again and again and again, unless you're some kind of sick person who just likes to go to the doctor for fun. But that's obviously not, what's going on here. The fact that the symptoms are so important, what kind of tips would you provide to a claimant to document their symptoms and also make sure that their doctors are getting all of the symptoms into the medical records?
It's really important, Greg, to make sure that there is documentation of all these symptoms, and that if the symptoms are progressing and getting worse, that the doctors are documenting that in their records, because if this is not the case, then the insurance carrier will run with that and say, well, they've had Lyme disease, the diagnosis happened 2 years ago. We don't see where the symptoms are getting worse or progressing, and they've been able to work for this long with the disease, so why can't they work now? So I explain to my clients, it's really important to make sure that you're open and honest with all of your doctors, and that you have the conversation with them that they need to really document every aspect of your symptoms, the care, the treatment, everything that's going on. And if the symptoms are progressing and getting worse, that needs to be in your medical records, because if it's not there, then the insurance carriers will, have a reason to deny the claim. Also, I will tell my clients they could keep a pain journal and document the symptoms that they're having, if it's pain or if it's other things that are affecting them. If they document that on a daily basis, that's something that we could provide the insurance carrier as evidence of what's going on with them. Because again, Lyme disease is, and there are objective tests to diagnose Lyme disease, unlike some other, unlike fibromyalgia, which there is no objective test for. However, most of the symptoms are subjective. So I do tell them it's very important to communicate this with their physicians, and also to make sure they're seeing the right types of physicians. So not just going to the primary care physician, telling them that you have these issues. You need to go see an infectious disease doctor that specializes in Lyme and is well versed in Lyme. Otherwise, the insurance carriers are going to walk all over the primary care doctor with their expert physicians refuting the opinions of the primary care physicians. So that's also a very important thing to do, is to make sure you're treating on a regular basis with the right type of specialist.
And then, Rachel, due to the subjective nature and the fact that a lot of Lyme disease claimants have cognitive difficulties, there's almost always, when a disability insurance company is going to try to challenge a claim, they'll try to set up their own neuropsychological exam to try to show that the claimant either doesn't have cognitive impairment, is malingering, or is exaggerating. And clearly we're experienced in rebutting those reports and dealing with those all the time. And often we try to get our own neuropsych report done first, so that we have a baseline as to what's going on cognitively, if there is going to be any indication, if the test results are somehow or another going to come back with malingering or exaggerating, that you can deal with those things and be prepared for that technique to be taken by the disability insurance company. Because you've battled so many of these neuropsychological exams, which, while they're supposed to give objective type results because you're doing testing compared to tens of thousands of people who have taken similar batteries of tests, there's still a subjective interpretation of the results done by the hired neuropsychologist. So that's something that is an ongoing battle in the disability insurance world that I know you deal with on a daily basis, especially with the Lyme disease cases. So in summary, thank you very much, Rachel, for that really detailed summary of Lyme disease and some of the controversial issues, and for providing some of those disability claim tips. The best thing that we do at this stage is to offer a claimant a free initial consultation to review their claim, whether they're considering filing or if they've been denied. We always offer an initial free consultation, and we request that you send us a copy of your disability policy, or if you've been denied, a copy of your denial letter, and we'll immediately get on the phone and let you know how we can help you. The other thing that's super helpful is to spend some time going around our website. Do a search by Lyme disease or search your disability company. You're going to find a lot of helpful information that's going to talk about how multiple disability insurance companies have handled these cases. You're going to find information about your specific company, reviews from other people, questions and answers that our lawyers have specifically answered for people that are in similar situations to you. And the reason we provide all of this information is that we want you to be really educated about this disability insurance process, so that you can think, at least partially think, like a disability insurance company. And if you're able to do that, you're going to put yourself in a much better position to understand what I call this game that the disability insurance companies play. And you have to know the game in order to have the best chance to get your benefits approved. So no matter where you live in the country, we encourage you to contact us. Our clients are nationwide, and we look forward to the opportunity to speak with you should you need us. Thank you.